Aortic stenosis is a disease of the aortic valve. What happens is that valve becomes thickened and hardened and rocky and calcified. And when that happens, that valve can't open and close like it normally should. Previously, the mainstay for therapy for treatment of aortic stenosis was an open surgical procedure. However, over the past 10 years or so, we've really seen a paradigm shift in the treatment of aortic valve disease. We're now treating the majority of these patients with what's called TAVR, transcatheter aortic valve replacement.
Biggest question that most people have about that particular procedure, about TAVR, is they do not understand how we can do this without opening their chest.
Different from surgical aortic valve replacement, with the surgical aortic valve replacement, the bad valve, the old valve, is actually removed from the body. With the TAVR procedure, we are putting in a new valve, but actually just pushing that old valve out of the way. And this allows the procedure to be really a minimally invasive procedure. Patients recover quicker, and complication rates are lower with TAVR compared to surgical aortic valve replacement. Having a TAVR program at St. Luke's, the Woodlands Hospital, is a huge benefit to our community. When the TAVR procedure first came out, it was something that was only done in tertiary referral centers. Nowadays, as the technology has improved and access has improved to the procedure, we now offer it locally to our Woodlands patients. Now they don't have to travel long distances to get the procedure done, and it's much more convenient.
The team that we chose, they're passionate about their patients and making sure that they live their life to the fullest that they can live it. We all had the same goal in mind. We wanted to see these patients have their life back, and being able to see them smile and laugh again is important to me, and that's probably the biggest reward that I get when I hear that excitement in their voice that they have their life back again.